Hey everybody, welcome back to the I Believe podcast. Today I'm so excited to bring as a guest on our podcast, not just our I Believe conference. We're hearing again from Julia Brechbiel, who's a psychologist at Fred Hutch Cancer Center in the Washington area. I think it's in Seattle. And if you went to our Seattle I Believe meeting, you got a chance to hear from her. And she had just such an incredible topic. And I'm so excited that we get to revisit mental health, especially, in light of Mental Health Awareness Month. So we're going to be chatting through, not in this order, but kind of the who, what, when, where, and why we might, as cancer patients, want to see, a specific type of health, mental health professional, or like kind of what types and modalities of therapy might be helpful. So we're going to run through a few of those things. And then hopefully as you're listening, this will ring true for you, in terms of maybe helping you narrow down how to find resources to support yourself throughout a cancer diagnosis. Because I think that too often we're kind of just thrust into the treatment realm, and then there's just very little support for but wait, like my brain is really struggling. I have a lot of emotions. How do I cope? So Julia, thank you so much for being a guest today.
Thank you so much for having me. I'm looking forward to chatting today.
Okay, so first up, who should we see, right? I'm a rare cancer patient. Nobody even knows my diagnosis. Like if I tell them I have uveal melanoma, most people look at me like I've grown a third arm.
hmm
Um, so who should I see and why? Like who, in your opinion?
Yeah, I think it's taking stock of what you're looking for in your mental health care and how much of what you're wanting to discuss is about the medical treatment, cancer treatment, or the impact cancer has had on you. When cancer is going to play a large role in your mental health care, it can be helpful to work with someone who has experience working in medical settings, and they can go by a lot of different names and titles. So it could be a health psychologist, a rehab psychologist, a medical psychologist. Those folks have either worked with cancer patients or worked with patients who have had other serious chronic illnesses and are going to be used to learning very quickly what is unique about your cancer or your personal experience of having cancer. Um, yeah.
Well, I feel like that's something that I struggled with. Like, I've been a
Mhm,
cancer patient with uveal melanoma for
mhm,
6 years. And while I've loved all of the therapists that I have
mhm,
seen, it's not been until this last year that I've really landed on one of those niche therapists, like you
mhm,
said, like a medical trauma psychologist.
mhm.
Someone who I don't really feel like I have to like explain my diagnosis during the
Yeah.
session. I actually can just jump into the meat of, whatever it
Mhm,
is that I'm struggling to cope with. So
yeah.
I love that you just kind of like explain that idea as like this
Mhm,
specialization for sure.
yeah. And I'm curious of like how you found that person because I imagine it's probably hard to find a niche provider. Like someone like myself typically resides at a medical center or clinic, but we are out in the community as well.
Yeah, so honestly, looking back, I'm one of those people who I kind of just think that sometimes the universe just shows up and delivers,
hmm
because I was going through some pretty severe medical PTSD,
hmm
and so I think I initially started the search there with like I was looking for somebody who specialized more in
hmm
PTSD,
Yeah.
and then when I got on the phone to have like
hmm
a
Yeah, good.
pre-call basically to
hmm
kind of feel him out as like a
hmm
therapist, he explained that his actual like clinical background is
hmm
in medical trauma psychology,
Yeah.
and that he specifically has worked like in a hospital setting in
hmm
medical centers similar
hmm
to yourself. And I was like, well, I don't know how I found you, but I'm glad I
Yeah.
did.
But I hear that clarity of like goal and what you were looking for, and that you took that pre-consultation opportunity to really interview him if he's the right fit for you. And I recommend, like, when I am discharging a patient to the community because they've graduated from working with me and they are thinking about someone in the community, I really encourage them to like have goals of like the topic or what you want to accomplish through this relationship and what is going to make a good provider for you. Because I like when my patients tell me I need someone who will give me homework, or I need someone who won't give me worksheets, or I need someone who feels confident talking about trauma. That makes it a better relationship between me and my patient.
Okay, so yeah, like I mean, I hear you that
Mhm,
me being able to kind of be clear in what I was looking for is probably a
mhm,
good piece of how I found someone.
mhm,
Um, I think, I think it probably helps a lot, frankly, to have a center like that is
Mhm.
established with medical psychology care, especially in the cancer world, because
Yeah.
there's just a lot of appointments, right? There's
Yeah.
a lot of things. There's like, even though we're seeing a specialist, like there's
Mhm.
still a lot of things that you manage as a
Yeah.
patient.
Mhm.
And I think sometimes therapy can feel like just one more thing,
Yep.
even though it might just be the one more thing that really could make a big difference in how
Truly.
how we're able to cope,
Yeah.
and how we're able to kind of process whatever we're
Mhm.
hearing in those appointments.
Yeah.
And I mean, too often I think like I hear about patients who go into appointments and they're essentially having maybe a discussion that probably would have been more effective to have with a medical psychologist, and they're
Mhm.
having it with their oncologist instead of being able to like make a plan
Mm.
and make a an educated decision, a well-informed decision about what they want their treatment to be.
Mhm.
And I just, I don't know, I find a lot of power in being able to talk, like kind of keep them in separate boxes, like my emotions, my feelings, my mental health
Right.
around my diagnosis, they go here, and
Yeah.
everything else goes here, and that just makes it a little bit simpler to like go into
Yeah.
those
More
appointments because it's
streamlined.
not overshadowed. Yeah, it's not overshadowed by like the layer of all of the emotions. Not that the emotions aren't there and that they don't come up. They absolutely come up.
Yeah.
But it's not the focus of the appointment.
Right. That
Um
you can differentiate
so
what you're trying to focus on instead
mhm.
of having to think about your emotions and coping with them when you're trying to talk about decision making. Because our emotions can
Yeah.
really get in the way of us making clear decisions.
Yeah,
Mhm.
absolutely. So I feel like we're kind of naturally leading
Yeah.
into this, but like this kind of bleeds into that
Mhm.
when
Mhm.
around, medical trauma psychology and just mental health
Mhm.
support. So when do you feel like is a good reason for a patient like myself or, maybe somebody listening to consider seeing a medical
Mhm.
psychologist?
Yeah, I think for me, I'm a little biased as a psychologist. I'm going to say anytime you think it would be helpful. And that can be for a lot of different reasons. It can be because something medical is going on, and you want help in that context, or um, the medical aspect of your care is getting in the way of other aspects of your life. And that can be emotionally, cognitively, like energy wise. And or it's causing mood symptoms that are getting in the way. So I typically say, like, if you feel different, if you're acting different, if you're feeling disconnected from who you are, your activities, other people, other people are concerned about you, then that's kind of the signal that you could use some help. And it's when I think of help, I think of maybe it's me, but it could be other people at a cancer center. So you can always start with a patient or nurse navigator or a social worker and then think, is this a short-term thing or am I wanting to dig a little deeper? And that's when one of those folks may recommend a mental health, like psychotherapist, medical
Yeah.
psychologist. And so most patients end up with me because what is medically going on is the forefront. We end up talking about it for most of our
Yeah,
sessions.
absolutely.
Hmm.
Where would I find this kind of mental health support as a patient? Where should I
Hmm.
start?
Yeah, I think a great way to get started is talking with your team at your cancer center. And so most cancer centers do some kind of screening measure or questionnaire about your needs. They may ask about how things are going with transportation or insurance, finances, and also maybe include something of like a depression scale, like a PHQ-9. And being vulnerable about those things lets the clinics, your providers know what's going on so they can help talk with you about, open that dialogue about how can we get you more support. And if your cancer clinic doesn't have a provider like me, it may have those resource people I mentioned, like patient navigators, social workers who can either support you short term or find you someone in the community. And so it could be, they might have like a list of people in that community that are used to working with people with uveal melanoma, or they may know of an organization like a Cure and Site, and through that network, either connecting with peers with cancer or that organization may help you through like word of mouth resource guides, find you someone in your area. Anything else? Other
No, I feel like
ideas or
that's super
strategies
helpful.
you've used?
I mean, just like I don't know, Psychology Today or like
Yeah.
whatever those like
Hmm.
the web search that
Yep.
you can
Yeah.
just start plugging in your insurance
I always
details, you
forget about
plug
that
in the
one.
things you're dealing with,
Hmm. Yeah.
and so I mean, I'm a little bit of a do myself
Yeah.
kind of person.
Yeah. No,
Um,
Psychology Today is what I'll use even sometimes if I'm trying to think of like who is a good fit for this patient. And so it could be helpful to fill that out with someone who knows you really well or who has done therapy before so they can explain to you what all those options and boxes are. And then some insurances have really good liaisons, like a nursing or like a behavioral health specialist that can help you find behavioral health. So we're really fortunate at Fred Hutch where we have like Primera specialist on site. Heidi is a saint, and I'll go to her if I have a Primera patient who needs someone in the community or even in another state. Like they've gone back to Colorado after care, and she found them people in Colorado. So people at the insurance company can be helpful, believe it or not, if you can get to the right behavioral health coordinator.
I think it's such a good way to just use your resources and
Mm-hmm.
use the people and like the people
Mm-hmm.
who are there to kind of think creatively about like how can we get you the
Mm-hmm.
best support for the situation that you're
Mm-hmm.
in.
Mm-hmm.
Um,
Yeah.
and
We have,
even if it's not somebody who specializes
mhm,
specifically in uveal melanoma,
yeah.
even just someone who is familiar
Mm-hmm.
with more chronic conditions or
Yeah.
just rare conditions,
Right.
like those are kind of some of those words that I guess I think of when I think of like
Mm-hmm.
how do I say that I
Yeah.
need support in a specific area, because
Mm-hmm.
uveal melanoma doesn't always ring the bell for
Yeah.
people.
Yeah.
Um,
Mm-hmm.
and so I think the other thing you said that I really liked was those like screening,
Mm-hmm.
the screening questions that we might get as patients
Mm-hmm.
in the doctor's office. I mean, I don't know about you guys. I feel like I'm one of those people who sometimes fills it out with the idea of like, well, like on a good day. And I think that I liked what you said about being vulnerable in answering those questions. Like that, there's not like you're not being graded on like, are you coping? They just need to know if you're not coping, then how can we support you? And what are the areas that you're struggling with the most?
Yeah.
I've definitely done the questionnaire and done it with the, unintentional, I'm filling this out how you think, like how I think you want me to.
Exactly. And that is totally fine because maybe that's not the goal for that visit because it's like your PCP. You're there to
Yeah,
get
for
like
sure.
your blood pressure meds managed. But when you do need it to be part of a conversation, when the provider or the MA or the CNA picks it up from you, they're gonna screen like use their really fast eyes and skim it, and it's gonna flag like let me set aside time in my visit to really talk about this because otherwise it the visits are so short with some of these providers, we won't know it's an agenda item otherwise, and it's so hard to get a word in edgewise sometimes in those short oncology visits.
That's such a good point in
Mhm,
terms of like just the time, right? The
mhm,
time that we have in these
mhm,
appointments. Most follow-ups I think are
mhm.
30 minutes.
Yeah.
And if you have, a longer visit, it might be because your doctor's going over and just not,
Mhm,
manning the clock,
mhm,
which is always nice.
mhm.
But but it can feel like there's just a lot of layers, I
Yeah.
think, when you're dealing with a cancer diagnosis and
Mhm.
when you're dealing with a rare cancer diagnosis specifically in just and there's not enough time in that follow-up, right, with the medical oncologist or the PCP or the dermatologist or whichever specialist you happen to be seeing to like cover all of the
Yeah.
pieces that are kind of like you said, kind of impeding your ability to, live your normal routines and like just live as well as possible. Because I think ultimately, like, that's what we want, right? We don't want to feel like we're overshadowed by cancer all the time, but sometimes it happens. And
Yeah.
like, when that happens, what do we do? So let's kind of move on to topics then
Mhm.
of like what are some of the kind of maybe examples of challenging situations that you've seen patients navigate, and I kind of
Yeah.
say this with a grain of we're going to kind of also address some of the things that I know that I've
Yeah.
navigated, mostly just because we know that we can talk about those pretty easily.
Mhm.
But let's just give people a taste of like
Yeah.
these couple of specific issues that somebody might
Mm-hmm.
address in like a psych, what did you call it? A medical psychologist? You
Yeah.
said something else.
There's a couple different names for it. So like health
Hmm.
psychology, rehab psychology, and medical psychology are probably the top three I hear from my colleagues. And rehab is like the idea of like being able to like reintegrate or adapt to a change
Hmm.
in our health or our physical functioning. And so in some ways, rehab is like a really nice way to think about what we do in a medical context. Um,
Yeah, no, that makes sense. I actually
yeah,
have never
great
thought of it that way.
question. Um, and so the time points or like the common things I hear about is typically along like the trajectory timeline of cancer, of new diagnoses, starts of treatment, um, maybe a scan or result is anxiety provoking or there's a lot of uncertainty at these stages, um, sometimes leading up to a big medical decision, um, or feeling like kind of just lost. Like maybe you finished treatment and now you're like reflecting on all that you went through and now you're in surveillance and you're like, what just happened and how do I go back and like reintegrate into life? So there's a lot of
Yeah.
different, like I think of like milestones or checkpoints that
Hmm.
I will see patients at different parts of their care at a cancer center.
Yeah. I think that's a really good, just kind of
Mm-hmm.
general list of like a few of the things that
Yeah.
you might consider
Mm-hmm.
chatting with the medical
Mm-hmm.
psychologist about. And I think, in the past year for me specifically, one of the biggest things has been this kind of invisible chronic illness burden.
Mm-hmm.
Like, I have a stage 4 cancer
Mm-hmm.
diagnosis. Many of us in the community are
Mm-hmm.
metastatic, and
Mm-hmm.
yet we don't look the same as metastatic people. So, like, how do we, like, I think a piece of this is how do we honor where we're at, but also like communicate that like invisible illness, that invisible chronic disease to friends, to family, to, the social media world that we're a part of. Like,
Mm-hmm.
and I think the kind of the, like, where would you say we kind of start with that?
Yeah, great question. I think recognizing that that's even happening with you, that's going on, of people are reacting to me in a way that feels inconsistent with how I feel. And I think of it as our stimulus value. What my appearance or how I carry myself when I enter a room, what kind of reaction do I get? How do people look at me and see me?
Mhm.
And even at the doctor's office, this can happen of like you appear healthy, that people might not realize you are the patient in the waiting room. Um, and I think it's happening more and more in cancer settings that society, social media thinks has this one stereotype of what cancer looks like in a person, and more people are actually really not looking that, like frail and bald and sickly. People
Yeah,
are
absolutely.
looking a lot healthier in care.
Yeah, it's a very unique kind of just situation to navigate,
Mhm.
and to kind of be fighting against that, I guess, media
Yeah.
stereotype of like what does cancer look like, and to kind of be, I don't know, almost having to kind of explain myself of like,
Yeah.
hey, like I'm tired, you don't see it, like I look
Yeah.
fine to you, I seem like I'm doing well, but like today I'm not, and like to just be able to have a space of I don't know, not being told like, but you
Yeah.
actually look fine, so you must be fine.
Right.
Like I feel like
You have to
sometimes
push
that
back a lot.
that pushback is challenging. So what I heard from you there was like just first we're really building the self-awareness for ourselves of like what's going on for me internally. Um, and then once you can kind of identify like that specific thing, like is it your appearance that people are referencing? Is it um, that they're telling you certain things and you're finding that unhelpful? Like what specifically is coming up
Yeah.
from the actions or the words of other people in your life that you're finding really unhelpful, and then like allowing me to then really specifically communicate about that.
Yeah.
Because I think like communicating about the whole disease sometimes can feel really, really overwhelming. Um, so what would be like maybe a specific way that I might try communicating that I don't find it helpful when people say, wow, like you look so good?
Right. And it's part of it is preparing yourself of like, I love that we're talking about this. And so thinking as you're listening of what how can you rephrase this in your own words of realizing this person either maybe doesn't know what to say, or maybe their intention, it's kind of like when you're passing people in a hallway or something, they're like, "Hi, how are you?" They're not really asking how are you. It's just a way of saying hi and saying if you can like just ignore that and move past it. But sometimes people really you feel put into a box that people really want to believe that you are okay, and that's invalidating. And being prepared to say, "Thanks for hoping I'm doing well. Actually, I'm having a really hard day." And so stating the honest truth and then telling them what to do about it, of saying it would be really helpful if we changed our plans today, or it would be really helpful if um, you could do X, Y, and Z instead. Like, can we
Yeah,
go
I think
somewhere else or
that's
go
specific.
change our plans? Yeah.
Well, and like you said, like some of this comes down to kind of preparing yourself,
Hmm.
which unfortunately sometimes only happens when we can retroactively
Yeah.
think back or
Yeah.
retrospectively think back on this is how something happened and I didn't really like how that
Hmm.
feels. So how do I convey
Yeah.
for the future
Yeah.
if this happens again, like this is
Hmm.
how I would prefer, to have you respond or
Hmm.
to have support.
Hmm.
And that can be kind of a tricky place to be. I feel like I was kind of in
Hmm.
that place recently. And it did help though. Like once I
Hmm.
was able to just communicate it.
Yeah.
Has anything happened for that to actually like be acted on? Like no. But it did help me like kind of feel
Yeah.
feel like it was no longer taking up space in my
Mm.
brain.
Yeah, like you don't have to
Because
do
I feel
this in the
like
moment. You
yeah,
can
like, and
do
the
it
mental
afterwards.
clutter though
Yeah.
that sometimes comes with like leaving things unsaid and just
Hmm.
kind of staying quiet,
Yeah.
that can be really hard for me. So
Yeah.
I find, that kind of blunt, honest truth to be
Hmm.
something that I lean on
Yeah.
sometimes, especially with people
Hmm.
that I trust.
Yeah.
Um,
Yeah, you're doing something
so I
really
appreciate
hard.
that.
Like that is saying you're doing it for yourself, not for other people's comfort. And that sometimes
Hmm.
is hard to speak up because we feel like, who am I to tell someone that they're being unhelpful? They're just trying to help me. But if it's causing you discomfort, that's okay to speak up and tell someone you don't like something.
Yeah, absolutely. So kind of switching gears,
Yeah.
one of the other things that I struggle with sometimes, especially around like scans, if I'm really tired or overstimulated, like either visually overstimulated because I have one eye, and I find sound and sight things like
Hmm.
driving even is so
Hmm.
overstimulating and fatiguing sometimes. Um,
Hmm.
but when I'm kind of noticing myself like lashing out in maybe anger or
Yeah.
just getting more irritable towards other people, like how do I deal with okay, like I've been lashing out, I feel bad about that, and then I have this guilt that like comes, but ultimately like I'm kind of coping with too much. Like how do I work on that?
Yeah. I think for me, I start with like a place of curiosity of like, why did I act that way? That wasn't like me. And we often have to wait until the wave of the situation or the emotion has passed to really understand what was underneath of it. And so when we're angry, for example, there is normally a layer under that. It's easier to be angry than to feel hurt or to feel sad or embarrassed. Um, and understanding what's underneath your anger can tell you what your need is. Like there something was going unmet. That in like your case when you're feeling overstimulated, the need for rest and breaks in an adaptive environment was going unmet. And you're gonna get
Mm,
angry of like, why can't things just be the way I need them to be?
yeah, absolutely.
So when you understand like what you need, the anger, those emotions are a type of fire alarm. That's your body, your nervous system telling you, hey, you have something that is going unmet. Pay attention, take care of this. Or um, it's like notifications on your phone. But if we just move past them and ignore them, they're just going to keep going off. And the fire alarm is just that smoke detector is just going to get more and more sensitive. And sometimes we also need to understand I might think everything is causing my anxiety because my fire alarm is constantly going off. Um, and sometimes, I don't know if your smoke detector is like mine, but I could just be using my air fryer and it goes off. And so understanding, is this really about the overstimulation in the moment, or is there something bigger going on underneath the surface? Maybe
Yeah, absolutely.
it is like the dishes weren't done and you are so exhausted, overstimulated coming home, but instead it's really about that people forget you are living with cancer and you need support and they forgot because you look normal and you feel like invisible and ignored. That's the real hurt under the anger that the dishes weren't done.
Yeah. No, actually,
Hmm.
that hits home.
Yeah, same,
That
same.
actually, I think, nails exactly how I was feeling
Hmm.
recently on
Hmm.
like, it was like a family trip,
Hmm.
and I didn't have my husband with me, and I had, family there, but
Hmm.
I felt invisible. I felt like everybody was looking at me like, well, you're fine.
Hmm.
And so you look fine, you must be fine, like therefore go be fine.
Hmm.
And I was having a really hard time like conveying in the moment, like when I was just completely exhausted. And
Yeah.
I mean, yeah, like I think that's a really easy way to put it, is I felt
Hmm.
invisible.
Hmm.
And that was where, my frustration, my
Yeah.
anger was really stemming from. It wasn't
Hmm.
necessarily that I was just tired. It was that I was tired and I felt like I was being ignored,
Right. Yeah.
or
And
just not noticed.
mhm.
And it was challenging because I was with people who, they love me, but also like my husband lives with me, so he's just more accustomed
Yeah.
to knowing and seeing
And adapting.
in real time when I need help, and adapting
Hmm.
as he sees that. People who don't live with me, they don't get the full scale of like, what is Danae like from morning to night?
Hmm.
They get a picture, they get a snapshot
Yeah.
of, an hour or two of time
Hmm.
that they might spend with me.
Yeah.
And that looks very different than how I might
Mm.
feel on a normal day. And
Right.
this was, these were not normal days.
No.
Traveling with 3 kids by myself, not normal
Whew.
days.
Yeah. And so other people might not even realize your fire alarm smoke detector was going off, whereas your husband is calibrated to it and he can see the warning signs and maybe even help prevent it from going off by adapting around you or giving you a quiet time and taking the kids and distracting them, giving you a rest break, and it goes unspoken. But even in hindsight, you're probably like, well, maybe if I had spoken up or if I had done planned things differently for myself, how could I have either prevented the smoke detector from going off or what could I have done differently when it goes off? So sometimes it's we have to work on it ourselves to prevent the smoke detector or to
Yeah.
respond to it, or other times we need to ask people to say, hey, don't you hear this alarm? Help me.
Yeah.
Mhm.
Well, and sometimes the smoke detector goes off and you don't realize it was something that was going to set it off.
Yeah.
And so then you have to just be okay with,
Hmm.
like, in retrospect,
Hmm.
I won't ever travel again by myself with my
Oh,
3 kids
yeah.
and not like, I just won't do that.
Hmm.
And that's something that I probably wouldn't have been able to come to that conclusion without having
Hmm.
the experience that I
Yeah.
did. And that's okay.
Hmm.
Um,
And having that like
but,
neutral
I,
reaction when your alarm goes off helps it from getting
mhm,
overly sensitive too.
yeah. And
Hmm.
that's one of those, I mean, I talk a lot about my kids' frustration tolerance sometimes with other people because that's something we're
Hmm.
working on. But like we have that too, right? That smoke detector, like making sure that it's actually going off when it needs to, not
Hmm.
every time that any little thing happens, is, I guess, really about like kind of building that frustration tolerance, or
Hmm.
that level of emotional and mental resilience for
Yeah.
your brain to
Hmm.
process something that's happening.
Yeah.
Um, and to process it, like you said, neutrally, instead of,
Hmm.
this is a fire, this is a tiger, I have to run every single time.
Hmm. And thinking
Because
if
that doesn't feel good, right? When our
no,
nervous system is
no,
is that shot.
no, and that like adds to the burden of living with cancer, that it adds to our cognitive, emotional, physical fatigue to have our alarm constantly going off and our nervous system
Yeah.
just on high alert all the time.
Okay, well, switching gears to maybe another little
Yeah.
tidbit of things that I'm hearing from,
Hmm.
other patients, something
Hmm.
that I feel like I struggle with
Yeah.
sometimes is, sometimes I have treatment often enough, and I have friends who like they have weekly treatment.
Hmm.
And I just like, I'm so glad I don't have treatment every week, but I also I just kind of struggle sometimes, even just with the maybe every few months or
Hmm.
every few weeks that I have something going on. Um, like I feel like sometimes I turn preparing other people to kind of have me absent turns into what I think is self-care.
Hmm.
Um, and it essentially turns into me doing my treatment to live instead of like doing the living part.
Yeah.
So what are like some of the kind of the things that you like to think about in that kind of regard, or like things you've worked with patients on in that idea? of like not just going to treatment for the sake of
Right.
going, like what are we doing
Mhm.
here?
Yeah, I think I hear this most kind of described as um, feeling like I'm living like 1 month at a time between labs or every 3 months for scans, and it doesn't feel like they're able to really live because they're living in increments and they really feel like the walls, the constraints are pushing in because of all the visits. And it is really hard to then shift our frame and our perspective to think, is it the walls closing in or has the room been the same size all the time and I'm not realizing how much room there is actually. I think of it like parallel parking. I don't think of how little the spot is. I think about my car's going to fit there. I just might have to try a second time, or it might be harder than before, but it's still going to fit. I'm still going to be able to do the things I want to do and focusing on what is it that I want to be doing when I'm not in treatment. I often think of a specific patient I've worked in when I hear this in my patients, and she said it really well of that I am living to go to treatment and I want treatment to help me go live. And so thinking of like, what is the purpose of my treatments and how can I either go to them differently or respond to my side effects differently or even negotiate with my doctor? Can I have it every other week versus one every 3 weeks because that's more predictable or vice versa? Or can it be on a different day of the week so the side effects hit me on more convenient days? Is all within your power to negotiate so that it's working for you instead of you having to go and work to be in treatment.
That's a good point.
Hmm.
I like what you said about like just like your treatment is there to work for you,
Yeah.
not
I work
for
for
you
my
to work for
patient.
it.
Yes. Yeah. Hmm.
And even just the idea that you can advocate for
Yeah.
like that, you know, sure, there might be a set
Hmm.
schedule, but like you're allowed to say, hey, I've got a family vacation. I'm going to skip a
Absolutely.
week. We'll have to
Absolutely.
do it the week after.
Yeah.
Like I don't feel like I've ever had a time from the moment I was initially diagnosed. I've never
Hmm.
had a time that I've said something like that to a doctor where I said,
Yeah.
"Hey, like we've got
Hmm.
a family trip coming up or we've
Hmm.
got a birthday on this week. Like I
Hmm.
really don't want to be doing that this week."
Yeah.
And that they've come back and been like, "Nope, like this is the only option. Like we can only do it this way." For the
Hmm.
most part, they've been able to be pretty flexible or
Yeah.
they've been able to work around, like, for example, my birthday. Like, I really
Yeah.
didn't want to have one of my procedures on my birthday. And I was like, can we avoid that week
Yep.
if at all possible?
Hmm.
And we were able to. And
Hmm.
so, like, I mean, it's just putting it out there so that
Yeah.
the medical team knows what to be on the watch for in the schedule,
Exactly.
right?
Yeah.
So that they can, you know, it may not always line up, but if they can, they absolutely will try to kind of
Hmm.
accommodate that.
Hmm.
Because I think that when we can feel like as patients that we're taking control in
Hmm.
those ways, that can
Hmm.
make a really big difference.
Yeah.
Especially like because we're dealing with so much variability in the
Hmm.
chronic illness. And like the ways that we have to manage our disease, like sometimes it's the appointment part, sometimes it's the physical part, sometimes it's the mental part. And like that can all change, like depending on what's happening in my treatment.
Yeah.
So
I think that's a big
I
piece.
just I love
Yeah. I think that
yeah.
theme of what's in my control, and it can feel like a lot of this is just happening to you and not in your control.
Hmm.
When you actually do have a lot of choices, it can feel like I don't have a choice to do treatment or not, but you are
Hmm.
making that choice to be in treatment. And you can make a bunch of little just choices about how treatment looks and thinking, like I've had patients who would rather feel bad on the days they're at work so they feel better on their weekends. And I've had patients do the opposite. Their work's really important, so they want to feel the best and they rather feel bad on the weekends. And so they've
Yeah.
shifted their schedules to accommodate that.
Yeah. And like adapting to that,
Hmm.
you know, with time can be easy,
Hmm.
but I like before when we were talking, you mentioned that can really be challenging and it's okay to like
Hmm.
to just admit and to accept that that can be challenging to do on the
Hmm.
fly.
Yeah.
Like when it's like an hour to the next, like that
Hmm.
something is changing rapidly, like
Yeah.
that can be a challenge to adapt.
Hmm.
But it is possible. And I love what you said about like those tiny little choices that we can
Hmm.
make to like kind of help us feel like we're gaining back a little
Yeah.
bit of the control in
Hmm.
something that is feeling really uncontrollable, or just uncertain in general.
Hmm.
So PTSD. I mentioned PTSD for me, and that
Hmm.
I don't know that I don't know that I ever like officially got diagnosed with PTSD, but that's what I was starting to notice is that
Yeah.
I was I was scanning for problems all the
Mhm.
time, and I was also feeling like a large level of dread
Mm.
about going back to a specific cancer center that I had had kind of a traumatic experience at the previous year. So if someone is experiencing PTSD, what are some of those
Mhm.
unique symptoms they should look out for?
Yeah.
Like, because
Mhm.
obviously scanxiety is going to keep coming up,
Yeah,
and what's
absolutely.
normal versus PTSD not normal?
Right. Yeah. So thinking about a couple different things in that there's anxiety, there are trauma symptoms, and then there's PTSD. And those are all different. So anxiety is general worry and difficulty controlling or reducing that worry, trouble relaxing. We can have situational anxiety, like before, during, and after scans, and then it goes away. Or we can have more generalized anxiety that we're worrying about a lot of different things and it can be impacting our energy, our sleep, irritability. And so, again, looking for the signs that something's going on in the rest of your life. Trauma symptoms is different. They can like look a lot like anxiety because you're worried and fearful. It can cause a lot of the same emotions, but there are some really distinct different symptoms. So one is like a traumatic event has to have happened. And it's really normal to have trauma symptoms after a negative experience or stressful experience. It is our body's way of telling us, hey, something bad happened. Let's not have that happen again. So you could have flashbacks or nightmares, these re-experiencing symptoms. That's your brain's way of learning what just happened to you and making sense of it and trying to be prepared again. It can also be hypervigilance, like your head on a swivel, looking out for danger, because again, your body's trying to protect and from the environment of a fire or a lion or tiger or bear, something bad happening. But in this case, it's a scan or an infusion or treatment. And then other things are um, changes in our emotions. Some people can get really high, overreactive emotions, and other times people can get really numb. And that can look like zoning out, dissociating. Um, Other reactions could or symptoms could also be around relationships and how you feel safety or if you want to feel in control or you feel out of control or if you're trusting other people or not. Um, and then changes in sleep like nightmares, I think I already mentioned. And the last big one is avoidance. If you're avoiding things, and again, it can make sense to avoid something because it's scary or dangerous, but in this case, cancer treatment, avoiding that has big implications. If you're finding yourself avoiding making a follow-up appointment, avoiding going in for a lab or scheduling imaging, avoidance is what causes normal trauma symptoms to then build into PTSD. It gets in the way of our body learning what is safe and what is tolerable and what's dangerous. And so, um, after a traumatic event, around half of people can develop trauma symptoms, and a small percentage of even those folks, less than a third, end up developing into PTSD. And that's when we really see those symptoms sticking around for several months and getting in the way of our functioning. Like we're not going to care, we're not taking meds, would be like the medical examples, but you could like I even think of like if you had a fender bender and you never go to that intersection again where it happened, that's a form of avoidance. It might not bother you, but if it's adding an extra hour to your commute, which can happen in Seattle with our love bridges, it would be something you would want to talk to so that you can get your life and functioning back to the way it was so you can feel like yourself.
Well, I think like you make a lot of really good points.
Mhm,
And so like if I do feel like okay, yeah, like I'm somebody listening and I'm checking the
mhm,
boxes for like wow, this has been
mhm.
like I'm 2 years into my diagnosis, I
Yeah.
still feel like I'm avoiding appointments. I'm
Mhm,
really really dissociated when I go to my
mhm,
visits. Like
mhm. Yeah.
who or how do I make sure I'm talking to
Mhm.
the right person
Yeah.
like to help deal with that kind of
Mhm.
specifically like more medical related PTSD?
Yeah. I think part of it is first thinking, how am I going to cope until I get feeling like myself, until I get who I
Hmm.
am back. And so I think of folks of like If you're finding that you zone out, like your oncologist says a word, or you see something on your report that says increased or activity, or flare or signal, and like these words just cause you to zone out, it could be helpful to realize that and try to use a coping strategy to ground yourself back into the moment. If like the common one that people have heard of is like the 5, 4, 3, 2, 1. The 5 things I can see, 4 that I can touch, 3 that I can hear, 2 that I can smell, 1 that I can taste, or if you can't taste anything, I say like a affirmation or a gratitude is a good replacement if you get stuck. Um,
Yeah.
and so thinking in your doctor's visits, how can you do that? Or how can you have someone else to be an extra set of ears? Because it's hard to advocate for yourself when you're actively in symptoms. I would say my trauma patients don't even realize it's happening to them unless someone on the medical team says, I'm concerned about so and so. They're not engaging, but they're telling me they really want to be in care. Can you help me figure out what is getting in the way?
Well, Julia, thank you so much for all of your thoughts so far. As we close out, is there anything specific you want to share, just kind of to us generally as we end, whether it's about, what we just talked about or anything else?
Yeah, I think we talked so much about speaking up. As we were talking, thought of another great way to do that is like maybe you have a provider that you have really worked with. They know a lot of your history, but cancer or what's going on medically is just not coming up in that relationship. And thinking, how can I bring them up to speed? I know here my colleagues at Fred Hutch will reach out to community providers to kind of explain to them medically what's going on so that that therapist or psychologist, clinician can be more effective to you. You can send them readings. I've had patients send me things all the time. I've talked to a lot of oncologists because there's a lot of cancer types I've never seen before. And we're willing to do that for patients. I think some patients don't know they can give us feedback. Um, and so that feedback dialogue with your therapist is so important. If I see that my patient isn't doing well and they're having a hard time asking or confiding in me about it, I also try to speak up with them about it, of saying, hey, I'm seeing us kind of hit a plateau or we're in a slump and therapy's not helping you as quickly as I want it to. What's going on and how can we problem solve this? Are we talking about the right thing or have symptoms gotten so bad that therapy alone isn't helpful? Can we open a dialogue to talking about medication and thinking if you want something short term or PRN for your emotions, or do you want something more long term or daily? I know we take a lot of medication already, but sometimes we're able to find a medication that helps with a couple different things. So, like two birds, one stone situation. Like maybe you're having pain or hot flashes or sleep problems, and antidepressant can help with a lot of those. When other medications might not be available. I have a lot of patients who can't take, for example, like hormone therapy for menopause, but an antidepressant can be pretty helpful for some of those symptoms. And so even talking with someone like me who isn't a prescriber about your thoughts about medication or hearing my thoughts about whether or not it would be helpful for you is another way to make sure your provider is working well for you.
I love what you said about feedback and like
Mhm,
just the ability to have that dialogue,
mhm,
even with an established like therapist or
mhm,
psychologist. They are already seeing
mhm,
that, just because you've kind of reached this plateau doesn't necessarily mean
mhm,
that you have to go find someone new.
mhm.
Like that can feel really overwhelming for sure.
Yeah. Mhm,
But, just being open to communicating and
mhm,
sharing what you're thinking, like I think that that's so important too. So
mhm,
thank you. And also like thank you for just validating like that,
mhm,
the mental health medications are there for a
mhm.
reason, and
Yeah.
they really are okay to tap into if we need
Mhm.
them.
Yes, they are helpful and they do work for a lot of things. And being able to talk about your hesitations for them can make them seem less intimidating or stigmatizing.
Yeah. Well, I think there's so much to be said just around that.
Mhm,
I mean, I'm a big fan of therapy, and I take
mhm,
an antidepressant every
mhm,
day. I
mhm.
just upped like my doctor's just upped my dose of my antidepressant just for at least for the short term, and then we'll see if we keep it there.
Yeah,
Um,
which is a great
and
point. Like
it's
these can
just
be modified and either increased and decreased. You don't always have to be on them, and it's not one size fits all.
Yeah, absolutely. Well, thank you, Julia, for being here and just for sharing your expertise and your knowledge, your compassion and your empathy, like just for patients who are dealing with this and just trying to navigate a lot of pieces, a lot of layers of having a uveal melanoma diagnosis.
Of course.
But we definitely appreciate you coming on the podcast and just discussing this. So thank you.
A pleasure. I look forward to chatting in the future again.
Same. We will keep in touch for sure. And I just want to give a shout out to our sponsors. We could not do this without them. Thank you to our sponsors for making this possible and just making sure that we can continue producing content that helps you guys as patients. And then I guess the biggest thank you is to you guys listening. Like, thank you for taking the time to listen. And hopefully this is something that's helpful to you. If not, maybe it'll be helpful to somebody that you know. So feel free to share, tag friends, and we'll see you guys next time.